to one-sided and local diseases. So these aphorisms start from aphorism number 170. Where Dr. Hahnemann talk about local diseases. So we have so many cases where 1, 2, or 3 symptoms are there, and we don't have any idea how we can proceed in these cases. Aphorism number 170. We already go through all case taking, all aphorism under case taking, and we have to remember all the rubric or all the aphorisms to understand one-sided and local diseases. We already go through every part of case taking. We already go through sign and symptom, totality of symptoms, epidemic diseases, sporadic diseases, how to take the case and how to understand a particular case. So Dr. Hahnemann in aphorism number 170, he write it down that hence in this as in every case where the change of morbid state has occurred. Every case, even though in aphorism number 5, if you remember that Dr. Hahnemann said in aphorism number 5, aphorism number 6, unprejudiced observer. So what we are taking when we have a case, we can only get the change in the health of body and of mind. We will only focus on what is change in body and what is change in mind. And in bracket, he says morbid phenomena, accident, and symptoms. Aphorism number 6. Here, Dr. Hahnemann says, hence, in this as in every case where a change of the morbid state has occurred. Any person who has a change of symptoms, morbid state, and remaining set of symptoms now present must be inquiry into, and without paying any attentions to medicine, which at first appeared to be the next in point of suitableness. So we gave the medicine, and after that, there are few changes in the body. Even after giving medicine, the given medicine already finished his work. And you find out that few symptoms already gone and few symptoms still remain there. The remaining set, we are focusing here on remaining set of symptoms. After giving medicine, we have
في اسطنبول
remaining.
جابوا دونير ده سكيبي ده
Can you please
بيعمل اكل تحفه تخين جدا.
mute yourself? So remaining symptom, we already give medicine. We find out that person having few ameliorations and few the symptoms remain in that case. The remaining set of symptoms now present must be inquiry into. We have to inquire about these symptoms, the remaining set of symptoms. That's why in case taking, Dr. Hahnemann says, whatever patient said to you, we have to write it down in the language of patient, in the language of patients. So here we have a morbid state and we have a remaining set of symptoms after your medicine finish their course. So without paying any attentions to the medicine, we are not going to pay attention what you already given in that case. Because if we focusing on that medicine, we will prejudice with that medicines and we can still get all the symptoms of that medicine. So we have to avoid focusing on that medicines. Inquiry into remaining symptoms, another homeopathic medicine. So we can find out any particular medicine which is belong to the remaining set of symptoms as appropriate as possible to the new state, the new state. New state now before us. So we take the case, we give the medicines. After a while, when the medicine finishes work, after finishing his work, we patients come to us for second prescriptions. So this is the part of second prescriptions where we take the case again and we have few symptoms which are remaining after the patients came to us again. New state now before us must be selected. If it should be so happen, as in not often the case, that the medicine which at first appeared to be the next best seem still be well adapted for morbid state and that remains. So it's not an often the case. This is not a often when we take the case again and we get the same medicine for the same person again. Very rarely, because every time when the patients come, we find out something else which cover these state, something else which cover the state. So here, other medicines as appropriate as possible for the new state before us must be selected. And if it should so happen, as is not often the case, the medicine which at first, what medicine you already given to the patient, and second time when you take the case and the same remedy is again appropriate for the particular state, that remain so much the more will it merit our confidence. If the same medicine is already given, is one of the a remedy which is suitable for the second prescriptions, then we repeat the dose, or if it is not suitable, then we select the another remedy. This is what Hahnemann give us directions. Also, it's depend. So second prescription is one of the most toughest selections of medicine. So we have to judge the first prescription, the symptoms, with what the symptoms are gone and what still remain. And after we have to retake the case we have to make the retake, we have to make again one new state, and we have to judge, is it the same medicine, or is it we have to change the medicine. So deserve to be employed in preference to another. So here, if the same medicine is coming again, then we have to repeat the potency. So this is given in 170. Again, in aphorism number 171, fifth edition and in sixth editions. I have both. So in non-venereal diseases, this is not a sexual related diseases. Non-venereal means these are psoric diseases. Those, therefore, that arise from soda, the non-venereal diseases which is arise from soda, we often require, in order to effect a cure, to give several antisoric medicines in succession. You cannot cure any disease with a single, especially when we are dealing with chronic case, we need multiple antisoric remedies to treat that patient. And every successive one being homeopathically chosen in consonance with the group of symptoms, and every medicine which you select for the group of symptoms should be similar, after the expiry of the action of previous remedy. When you already given the medicine and that medicine finishes course, and after that we have to select one more remedy, so that remedy can be a complementary, it may be a follow well remedy, or any other antisoric remedy. So in 171 aphorism, especially when we are dealing with psoric diseases, we need several remedies, and every time after your previous remedy expires course, then we have to select that remedy, and it's depend, is it the same remedy or is it the different remedy. If it is the same remedy, we will go for higher potency, and if we go to Hahnemann advice, especially if we are using 30 potency, according to the Hahnemann chronic disease, we have to come down, or it may be we can use 24, 18, 12, 6 potency. Especially chronic disease, page number 27, footnote. So these two aphorisms are second prescriptions. But in sixth edition, Dr. Hahnemann says in non-venereal chronic diseases, therefore arise from sora, we often require, in order to effect a cure, give a several antisoric remedy in successions. These successions one being homeopathically chosen in consonance with the group of symptoms remaining after completion of the action of the previous remedy. After completion of the previous remedy, when the first remedy is done his course, and after that we will start the second one. So in 172, now from here we have started one-sided diseases. A similar difficulty in the way of the cure occur from the symptoms of the disease being too few. This is the biggest circumstances we guys are facing many times when the person having very few symptoms, one or two symptoms, and we have to select remedy for that person. And this is like a tip of iceberg. We can see the tip, but we cannot see what is behind, what is below that tip of the iceberg. So it's circumstances that deserve our careful attention. This is the part where we need more focus, more attentions. Why these two, three symptoms are there? Why the person does not have any other symptoms? Why the patient has this problems long ago, but only two, three symptoms are there, like a back pain or like external eruptions or like a pain in one place like this, like a heaviness in one place like this. For by its removal, almost all the difficulties that can lie in the way of this most perfect of all possible mode of treatment. Once we remove these symptoms, treat this symptom, remove these symptoms, the whole circumstances of treatment will be automatically gone, except that apparatus of non-homeopathic medicine is still incomplete, because at that times we have only a few remedies are there, so we are not able to get a perfect cure at that time. But now we have enough number of medicines, enough number of remedies, we can find out the exact similar remedy for these cases. So a, a, a case which having a very few symptoms are known as one-sided case, and we need more attentions here. In 173 aphorisms, the only diseases that seem to have but a few symptoms. The only diseases, we can see them, they are there, but only having a very few symptoms, and on that account to be less manageable, easily proceeded or controlled. To cure, they are not easy to cure because they give only few symptoms, they are give us few indications, but they will not give us a proper internal state of that patient, are those which may be termed as one-sided. These are called one-sided by Hahnemann. Few symptoms, very few symptoms, because they display only one or two principal symptoms. Because they are showing only one or two principal symptoms which obscure, not discovered, or known about, or uncertain almost all the others. You can only see two or three symptoms, but the remaining state, the remaining accessory symptoms will be away from you. They are uncertain, they are not discoverable. They belong chiefly to the class of chronic diseases. They are almost belongs to chronic. Please unmute yourself, please. So they are belongs to class of chronic disease. They are not acute conditions. They are a chronic disease if the person having a 1, 2, 3 symptoms, only a few symptoms or 1 or 2 principal symptoms. And after that, the patient will say, oh, I don't have any other symptoms. I don't have any other problem. I have just a pain here. I just having a this symptom or that symptom or ABC symptoms are only there, but I don't have any other problem. Any other problem. So as I already present one case of cone in the foot. The person having a condition or a problem from 1 year, just having a cone in the feet, and she doesn't have any problem. And after 7, 8 months, the cone going to start painful. She has a pain in the foot after wearing the foot shoes, and that time she realized that, oh, that is the problem, it will increase. So now I need to take a medicine. How many symptoms she give me? Only 2 symptoms, just corn and pain. And then you feel to this is the time then you inquire the case. Did you take any medicine for it? The first questions. And she will tell you, no, doctor, I didn't take any medicines. Because that time, that condition, that problem is not disturbing me. I know that there is a cone because that cone is not painful. So I didn't take any medicines. So here she give you a state of, what is the state of? When the person know that she has a problem and she didn't take any medicine, what is called? This state is known as, anyone? When the person know that he has a problem, but he didn't take any action.
Sir, denial?
No.
Ignorance?
No.
Then no idea. Frivolous?
No.
Frivolous?
No.
Childish behavior?
No. Anyone? Any guess? When the person know that he has a problem, but he is not, sorry?
Heedless.
No. Anyone, any other person? No denial. He know that he has a problem, but he is not taking any action because that condition is not affecting him or her. This is called indifference. Indifference. But after indifference, the corn start paining. Now she realized that it will increase. I have to take medicine. I'm not able to do my own work, my casual work. I'm not able to do. So she consulted me. And now she gave us symptoms that, oh, doctor, I have a corn in the feet, and now it start paining. If you give some medicine, I can get rid of it. Because from last few months, I have this problem, but I don't have any problem. Now it start paining. It will increase. This is called, anyone, any guess? Doctor, it will increase now. Give me some medicines.
Anticipatory.
No
Anxiety.
anticipatory. No anticipatory. Anticipatory is always attached with the future, not with present conditions. And it starts
Hypochondriac.
slowly.
Hypochondriac.
No, hypochondriac. Hypochondriac is that, doctor, look at this.
Exaggerated.
I have this pimple.
Exaggerated.
It's not painful. It's not anything. Doctor, give me some test. I just want to know that what happened here. This is called hypochondriasis. This is, yes, this is fear extravagance. This is,
Extra?
sorry?
Feeling extra? What?
No, fear of extra vengeance.
Oh, fear.
Only one remedy, opium, is there. And this person cure in 48 hours.
Yeah.
48 hours. 1 year old problem. 48 hours. Opium is the remedy, and indifference and fear of extra vengeance is the state of that patient. This is the state. What he or she give us, just a cone, that cone is now painful. So as Dr. Hahnemann in aphorism number 153 mentioned there, he says, the more general and undefined symptoms like loss of appetite, headache, debility, restless sleep, discomfort, or demand but little attention. Aphorism number 153, last 4 lines. If the person having these general symptoms demand very little attentions until and unless they have indefinite character, until they have an indefinite character, until they have a very peculiar character, very peculiar time. Doctor, 11 o'clock, my pain start, headache start. Very peculiar. Doctor, until, for example, I wake up in the morning, I need a breakfast 11 o'clock or 10 o'clock. If I skip my food, headache will definitely start 11 o'clock. Timing, absolutely characteristic. So this headache is now characteristic, very peculiar characteristic, and when this is repeating again and again, then it become a peculiar characteristic of that person. So we will not focusing on cone here. We are not focusing on pain here because there are lots of remedies which can be used for cone and pain. Mostly people prescribe antimicrobial if the cones are painful. Every person, but state is different here. We are focusing on state. Why she didn't take medicine? Why? Ask every person. If they have a very few symptoms, ask this question: what medicine already did you take? What action did you take before for it? And he definitely called, doctor, I didn't take any action. If this is with light mood, for example, oh doctor, oh, this type of things I cannot bother, I never bother these things. And somebody, when I was home, my mother says, oh, you have a problem, take this medicine, take some medicine for it. So she says, I come here. This is frivolous. This is frivolous. So we have one question: how to differentiate if the time is a peculiar symptoms? Wait. Or it is as a structure, as a mineral trait. So can you ask your questions again, please? Laura, are you there?
Yes, I'm there. I just need to know the difference because you said it's a peculiar symptom, the timing. If somebody like skips something and that's a regular or there is a pattern here,
Okay.
versus there is a mineral trait who is structured. That's the fundamental trait of a symptom of a mineral. I mean, who is structured and more of having this scheduling thing or
No,
that's
we cannot focusing on this structure things because this is a misconceptions. If they are particular person having a particular times, we cannot judge it. Sensitivity. For example, we have lots of remedies having a time structure. And if you guys having a synoptic key, can you please open it? If you guys have a synoptic key, I give you a wonderful example. Okay. Synoptic key, where in forward having a second paragraph, and in second paragraph, Dr. Boger says this account is then amplified and more accurately defined by the questioners, and who should first try to elicit the evident cause and course of the sickness, and then you can add the second most important thing here, the timing. When this happen in 8 hours or 24 hours, what is the particular thing? And many times you will get information that doctor, whenever he sleep, even he wake up at almost 1 o'clock in midnight, and he was that time he is not able to breathe for 1 or 2 hours. Can anyone tell me the timing period of medicine? Can anyone? If the person wake up midnight, after midnight,
Arsenic album.
yes, this is arsenic album timing. Person having a problem, doctor, whenever I wake up in the morning, doctor, my headache start, and it reach in the afternoon, and until in the evening I have slowly it goes down. Can anyone tell me the medicine?
Natremure?
Yes,
Natremure?
Natremure. And one person, doctor, it start whenever night start, and it finish when the morning start. Anyone? Sunset to sunrise. Anyone?
Oromet, sir.
No.
Mercurius. Mercurius.
Syphilinum.
Syphilinum. Absolutely correct. This is syphilinum. Sunset to sunrise, syphilinum. So this is a particular, if anything you will find out in a time structural timing, then you have You have to go. You cannot miss this symptom. This is one of the most important symptom. We cannot leave it. Timing. And if you see the repertory, first is journal, and after timing, morning, evening, afternoon, midnight, before midnight, after midnight, this will come. It means timing is the next most important after evident cause. If you find out evident cause is the first very important part, and second is timing. When this happened, this is most important here. So general symptom, if you get the general symptom, give very few attentions to it. Headache, loss of appetite, any eruptions or like corn, painful, until and unless they are very characteristic. Until and unless they have very peculiar natures, then we can consider them. Otherwise, we have to find out the state of the patient. Then we have to focus on the state. So here in 174, the principal symptoms, whenever you have a one-sided case and the person having a few symptoms, one or two symptoms, the principal symptoms may be either an internal complaint. Again, listen carefully. The principal symptom, what principal symptom that person have? Doctor, I have a headache. And what is the next here? Headache of many year duration. Principal symptoms may either an internal complaint, for example, a headache of many years, diarrhea for long standing, or ancient cardialgia, pain in the chest. Or it may be the affections more to the external kind. And we will get these symptoms many times in our routine practice. So many person will complain to you, doctor, I have this problem from 20 years, 30 years back. And I take lots of medicine, lots of doctor, but I didn't get any relief. So many. And can anyone tell me the rubric for it? The state of it? The person says, doctor, I take so many remedies. I visit so many doctors, but a never single pill give me a small relief. Anyone, any guess?
Yes.
Despair, sir. Despair.
No. No relief. Took lots of medicine, lots of doctors, lots of medicine, allopathy, Ayurveda, anything, but no, nothing give me a single relief.
Discontent.
No,
The dissatisfaction.
no,
Doubtful to
no,
heal.
no,
Hopeless?
Doubtful recovery of medicine is useless.
no,
Hopeless?
no. How we can understand hopeless, doctor? I took so many medicine, doctor. Now I feel that I will not able to cure. This is hopeless. The statement is, doctor, I visit lots of doctors. I took so many medicine, this medicine, that medicine, and you name it, I will take it. But nothing helped me.
Arrogance.
Sorry?
Arrogance.
No. Where is arrogance? No. No.
Like I'm above everything.
No arrogance.
Okay.
NVTDM.
Huh?
NVTDM.
No. Any guess? Try more try. You
Giving
guys are
up?
very close.
It's a giving up state?
Sorry?
Giving up state?
No. Anyone?
Did you say it's hopeless feeling from disease, from recovery?
No.
No.
So this is your homework. Find out.
Despair?
No disappear.
We did say that, but
No disappear. She takes so many remedies. No painkiller is affecting me. Nothing. Doctor, I take so many medicine. I can take if I have a pain, even painful medicine not give me any relief.
Discouragement.
No.
Disbelief?
No.
I already told doubtful bad.
No, doubtful. This is not doubtful. Look at the condition of his body. He's
I think
taking
it is
so.
not mental. It is more to do with getting used, the system getting used to
This
taking so
is
many medicines.
called non-reaction of the body. Body is not reacting.
Yes.
Okay.
Yes.
Exactly.
He's
Yeah,
taking medicine. This
low
is called
susceptibility.
Discontented with everything, sir.
no. Non-reaction. Body is not reacting. Opium
Yeah,
condition.
I have just written lack of reaction. Yeah.
Lack
Yes.
of reaction. Body doesn't give you reaction. Even he taking so many medicine. And I told even painful painkillers not giving relief.
Mm-hmm.
No reaction of the body.
Yeah, it is more physical, not mental.
This is more peculiar.
Mm-hmm.
This is more characteristic. You give him a painkiller, but he is not getting any relief. Very peculiar. Very peculiar condition. Doctor, so many things I took, so many treatment I take, lots of painkiller, but a single remedy will not give me relief. He give you a state, but this is us to understand it. No reaction, non-reaction. Lack of reaction is the particular rubric of this lack of reaction. Now this is a state of the patient. This is called painlessness in rubric language. Painlessness, lack of reaction. Everything he is taking, but body did not react. Body did not react. Body did not respond. Lack of reaction is the rubric for this, and you will find out in Pathak repertory. Lack of reactions. Lack of reactions.
But how can it be painlessness?
Pain. What is painless? Somebody is giving you a needle and person does not have any pain, any reaction of the body. The whole body is cutted out and patient doesn't have any pain. This is called reaction, lack of reaction. And in other words, if we read Materia Medica Pura, you will find out that this is the quality of opium where the person doesn't have any pain. In primary, when you give medicine, the opium will not produce any kind of pain. Very rare, very peculiar.
And that is correct. But painlessness and lack of reaction are two different things.
Yes, both different things. But I'm talking about here state.
Okay.
I am not talking about the symptoms. This is the state. And this is the version of the patient. Doctor, I talk lots of medicine. I visit this doctor, that doctor. A single person is not giving me relief. Even now I'm taking the painkiller, but I didn't get any relief. This is the state. This is lack of reaction. And if you miss it, your medicine will be different. This is the state. And wait, I will show you the symptom. And there are so many medicines are there having a lack of reaction or poor reactions. And first remedy is Ethusa synapium, lack of reactions. Ammonium carb, Ambra gracia, Antimtart, Calcarea, capsicum, carbovec, conium, cuprum, digitalis, ferrum, gelsemium, halliborus, laurocirrhosis, medorinum, moschus, oleander. Opium is the main remedy here. Phosphoric acid, sorinum, sulfur, syphilinum, tarantula, very sensitive, but lack of reactions is there. Tuberculinum, zincum. These are the remedy having a lack of reactions. Now, you have a group of medicine and you have a state of the person. Now, we have to focus on state. Focus on state. So, if the general symptoms are there, give little attentions to that general symptoms. But where we have to focus on general, we can discuss it in next rubrics or in next aphorism. So here, principal symptoms. Focus on principal symptoms. Here, headache of many years, diarrhea of long-standing and ancient cardialgia, or it may be affections more of an external kind, like eruptions, like itching, like skin tags, warts, like this. Disease of the latter characters, it means diseases of the external kind are generally distinguished by a name of local maladies. We can call them local conditions, local maladies, local diseases. So we have one-sided diseases and we have local diseases. If these are internal and having few symptoms, these are called one-sided. And if these are on external plane and in particular part, then we are called them local diseases. local diseases. Then next, so in one-sided diseases of the first kind, like headache in many years, diarrhea for long-standing, cardialgia, so many things. One-sided is of first kind. It is often to be attributed to the medical observer want of discernment, ability to judgment. So if the person does not have want of ability to judge, many times person don't have that much observing power to understand these internal diseases, that he does not fully discover the symptoms because of his lack of understanding, because of this lack of knowledge, because of there is lack of understanding, knowledge of subject or the patients, we are not able to explore the whole internal. It means we see the tip of iceberg, but we are not able to find out there is so many things below it. So he does not fully discover the symptom actually present, which would enable him to complete the sketch of portrait of disease. Because of his lack of knowledge, he is not able to understand the case. So here we are lacking. For example, we are discussing now and we have a difficulty to understand the state because we have a lack of communication, because we have a lack of knowledge, or we are lacking in discussion. This is the main thing here. So here, if you don't have knowledge, we are not able to complete the sketch of the portrait of the disease. In 176 aphorism, there are, however, still a few diseases which, after a most carefully initial examination, Dr. Hanneman says, there are so many times, if we have a lots of knowledge, if we have a careful attention, if we are a careful observer, careful initial examination, 84 to 98 present, but one or two severe violent symptoms, while all the other are but indistinctly perceptible. The person only have 2 or 3 symptoms. Doctor, I have a headache. I don't have any other problem, and only in headache is the base problem, and I have this headache since my childhood. And he only or she only give this 2 or 3 violent symptoms, and this is us to explore now everything. This is us to understand. This is us to ask the questions, not from the patient, mother, father, and any person who can describe the condition of that girl. And I share one case with you guys. I have one 16-year-old girl, and the person, just wait a minute. So I have one case of 16-year-old girl, and she having a epileptic attack. And this is the only symptoms that mother give me, just a epileptic attack, and she has this problem after his first menarche. Once the period started, after that she get these epileptic attack. And I have one experience that many times, because a few months before I treat one case having a similar problem, but that girl having a she has a past experience with his relative with a personal physical some problem, because one elder family member abused that girl, and after that that girl getting these symptoms, she has epileptic, and not epileptic, but these are hysteric fits, and I cure that girl with ignitia, because his whole arm stuck, she's not able to move that arm, and she's not able to move this arm, and having a silent brooding like this she's cured with the ignitia. But after taking the case of it, I find out very peculiar, very characteristic symptoms. The mother says whenever periods are are coming, whenever she has a timing of her period start, she has this fits every month, whenever her period started, she has this fits. And this is the only peculiarity of this case. Anyone who just want to try the medicine, very peculiar character. This is not a hormonal disturbance.
Conyo?
Lachesis?
No.
Did you hear Conyo?
No. Just period start.
Bufo? Bufo?
No bufo.
Lycopodium?
No.
At the beginning.
Any one guess?
Pulsatilla, sir.
No.
No platina?
No platinum.
Starts at the beginning of menses, right?
Just 1 or 2 days before. No sepia. Open keynotes, everyone. No Netramure. Just open your videos camera, please. And open keynotes. The remedy is calibromatum.
Oh.
Read calibromatum. Epilepsy. First, she gave congenital. Second, syphilitic. Third, tubercular. Usually a day or 2 before menses. At a new moon, headache follows attack. Epilepsy, very, very peculiar. She has a particular time every month, because this is a periodical. This is periodical. We need a periodical remedy. Every month, whenever menses start 2 1 or 2 days before, she has an epileptic attack. And after giving a dose of calibromatum, still we have 6 years now, no attack, no epileptic attack, nothing. Just one dose of calibromatum 200. Very peculiar. Allen's keynote is verified symptoms. One symptom is here is characteristic. This is characteristic. We are not so focused on state. She give you a wonderful state. And this condition start after menarche. When start menses, this condition start with it. And every month, whenever periods are about to start, she has an epileptic attack. And even in this case, I inquire about, because she is from a poor family, and she has a long way to go to school. And I ask her, is there any boy or anyone comes near you, or because of she can or he can abuse with you in between? She says no. Or even any teacher like this, or any teacher behave like with you? And she says no, I don't have any issue with anyone. But it start with the menses. Now, as according to Boger synoptic, once you have a evident causation, periods is as evident cause. Once the period start, she has this problem. Now you have a particular time period, you have a periodical remedy, you have a syphilitic remedy. This calibromatum is a syphilitic remedy. Anti-miasmatic remedy you have now. And I never repeat any medicine after it. Just one dose, case done. Very peculiar. And we know after that, after this case, I make a seminar where I describe 36 remedies with these type of characteristics. Very peculiar. Very, very peculiar characteristic. Once you get this characteristic, the patient will cure. Doesn't matter how long he was suffering from epilepsy. And one of the most character of this remedy, having a severe headache after this peculiar epileptic attack. Severe headache. Having headache following attack. Once the attack finished, the person having severe headache. And if you miss the first thing, you can focus on second thing. But that attack should be periodical. And if this is the case of male, because in males there is no menses, but if this is a periodical, and if says every 28 days, every 26 days, I have this problem. And one more important thing here is the new moon. And new moon having a 28-day circle. And if this is the case of male, and just ask them when this episode come, and you have the knowledge of moon. So this is easy for you to understand and prescribe the remedy.
Yeah.
So one or two severe symptoms and other are indistinctly perceptible. We are not able to touch them, but they're having a very peculiar symptoms. So in order to meet more successful such a case as this, which of very rare occurrence, we are in the first place to select, guided by these few symptoms. If the patient are not able to give a more clear view of your remedy, focusing on these one or two symptoms, as we are focusing on that epileptic attack. Everything is going on around this epileptic attack. Everything, just focusing on and get the complete symptom of that patient. When this happened, after, during menses, before menses, what happened during menses, when the patient having start menses, this has come, and what happened after having a very severe headache? Nothing before, nothing after. No symptoms, no epileptic attack in between. And this is a periodical condition. Every month it happened. Now you have a very peculiar state of the patient. State of the patient, not only symptoms. We have a state of the patient. So focusing on these few symptoms, we have to focus on it. The medicine which in our judgment is the most homeopathically indicated. So today we will stop this discussion here. We have so many things we discussed today, and now if you have any questions you have. Can you please open your cameras so we can discuss more clearly? Yes, please. Any questions you guys have? Because this is one of the important thing here to understand, because we all face this problem every day. Person having a few symptoms, or person having a 1, 2, 3 symptom, or person having external eruptions. We will discuss in next session about the external eruption. If person having external eruptions, how to deal with these cases. But here, this topic is more important for everyone, for us, because we are facing these things. We are focusing on these things.
Yeah, but the question is like we always don't get the peculiar symptoms in every case. If it is the case, it should be solved, you know. Many of the time we get in the repartee even. So, but we don't have all the time peculiar symptoms. It's only one side local symptoms, one-sided, but they are not peculiar.
So
So there are different ways to handle this.
yes, every person having a different experience, every person having a different way to handle this. But if we are talking about Hahnemann, how Hahnemann deal with the cases, how Hahnemann wants us to be focused. He says just focus on the state of that person, how the person is living with this situation, one-sided diseases or external eruptions. Definitely he did so many things to cure these conditions. Maybe he visits so many doctors, maybe he visit and many times patient will tell you, doctor, now I'm tired, of taking medicine. I'm already taking so much medicine, so many things, but I didn't get anything. I'm lost now. Now he give you a state. He give you a state. He give you a particular state. So we have to understand this state. That person give us information, and the person is giving us an indication. The person is giving us a peculiarity of the case. Doctor, tell me how much time I have to take medicine. I'm tired. Anyone can give me a rubric for this state? Anyone?
NVTDM.
Yes.
NVTDM.
Yes. Annoying. He is now tired of taking medicine.
Which remedy is that? Did he say remedy? Did you say remedy or did you say the symptom?
He explained, he tell the state of the patient. I will give you a.
Okay.
The rubric is ENNUI.
ENNI. Inui.
Yes. This is the state, doctor. How much time I have to take medicine? I'm tired now.
It's also
not
called
getting-
boredom, right? This is the
Yes.
boredom kind of.
Yes, he's
Yeah.
bored now.
Mm.
He's bored now. This is the state. If you miss this state, you miss the remedy. You miss the remedy. Second state, doctor, I visit so many doctors. So many. Nobody understand me even today. Nobody understand. And there is a very peculiar laugh on the face. Nobody. And you have to ask why you visit me then. If nobody understand you, nobody, and he has eruptions, he has so many things, and doctor, till now I visit hundred of doctor, nobody understand me. And second version, doctor, I visit so many people, so many doctors, so many cases, so many reports, everything is there, but nothing helped me. I'm tired now. I don't know I will get treatment or not. I'm just trying every day until somebody give me any treatment or some give me a relief. But I'm still trying. Anyone? This is a state.
The frustration.
No.
Despair of health.
Sorry?
Despair.
No despair. No despair. No hopeful. No hopeful.
Stuckness?
Sorry?
Stuckness, stuck at a point.
No. Sir, I am trying. I try my best. But
Perseverance.
Sorry?
Perseverance.
Yes, this is perseverance. He is continuously trying. Hope so he will somebody give me relief. This is called perseverance. Perseverance, continuously is trying. But if he stop trying, then
Despair.
Yes, this is called despair. Now he is despair. He's not want to try more. Now he has a despair of recovery. I will not able to cure. If somebody says, "Oh, you will be okay one day," he will very angry. Give me the remedy. Arsenic is the remedy. If somebody says you will be okay, and he knows that he's not able to get a relief, and somebody says, oh, you will be okay one day, and he will be angry. Arsenic. This is arsenic state. Understand the state, you will get the remedy. That's why
Arsenic
I'm
is
more
for,
sorry.
yeah, arsenic is for the despair,
Yes.
not for, okay. Okay. How about the perseverance?
Perseverance. Sulfur is one of the most important remedy here. Perseverance, continuously working. Maybe somebody give me relief.
Okay. Because it's an opener, right?
Yes.
Yeah, okay.
So any other question? Any other questions?
So I tried to ask this question when the case about the girl whom she had epileptic fits, and then it was related with the first days of the menses.
Yeah.
Why don't we think of a hormonal remedy instead of a
We will.
periodic?
No. We are
Because
not going hormonal. This
like an extra point.
If this is a hormonal remedies, then she should have a disturbance in his menses. But there is no disturbance in his menses. Nothing there. Menses are regular. Menses are on time. Menses are for 5 days. No problem is there. But she has, before 1 or 2 days, she has that epileptic attack. This is only peculiarity of this case.
Okay, and if there is, for example, like symptoms for the guts or something as a gut disorder, and then it's also peculiar with the first days of the menses, then this is also a peculiar, this could be related to something, to this gut problem. We think
She
of this.
doesn't have any gut problem.
No gut problems.
No.
Or what? So what we think of a periodical remedy?
Sorry?
I think she's asking if this calibromatum has got the same, you take it into consideration if somebody is having a gut problem, and the periodicity is there every 28 days or every, so would you consider calibromatum?
No, we will not consider it. If this
It's
is
only
not
with seizures.
If the person having a seizure, but that seizure is not attached with the menses, but this is attached with gut problem, then we have a remedy of China.
Okay.
Okay.
Very peculiarities attached with the gut system, because China have so many problem with abdominal, and so many things arise from a abdomen. But yesterday I read very peculiar symptoms of China. I just want to share with if I find
Okay,
out.
but if there is a gut problem, and it's a periodic thing with the menses, and it's regular and everything is okay, but shall we consider a remedy for the gut?
No, we have to ask so many things to the patient, because if this person particularly attached with the gut problem, and we have to find out what kind of problem he has with the gut now. Is it when the gut problems start, is it this epilepsy start with this, or she has first gut problem, after that slowly she has this problem? But
for example, if there is, if there's is a constipation or any kind of any problematic thing that's related to the flow or whatever, can this
so
be
did you
related,
have
like,
this case?
I have a case like this, so I'm trying to figure out if there is, for example, diarrhea for the patient, or mainly not diarrhea. I mean, the patient is not constipated first day of the menses, and throughout the timing, not as regular in the bowel movement, but
Okay.
it releases with the menses. Can
So
we
is it
consider this? Yeah.
is it this epileptic attack start with the menses?
There's no epilepsy for the patient. I'm just trying to relate if there is a periodic thing regarding periodic thing. It's the periodicity is for the menses, that
Yeah.
it kind of gets better, but
Yeah.
then it's not an epilepsy. It's just a gut disorder, or constipation,
Okay.
bloating. These symptoms like the IBS, irritable bowel syndrome.
So there are lots of remedy having a periodicity. Maximum times, if the person having a peculiar periodicity, after if this is repeated after 7 days, then we have sanguinaria canadensis. If it is come after 8 days, then we have a sulfur. If this is repeated every month, same times, then we have a China. If it is repeating hourly, every day, hourly, then we have sulfur and natramure. And if it is repeated after midnight every day or every alternate day, then we have arsenic and China.
Okay, thank you.
Any other question, please?
Okay, thank you.
Citron medicines are also have periodicity.
Yes.
Did you say anything and I missed? Every third day? Periodicity every third day? Or you didn't?
Every alternate day. One today
No.
have a problem, second day
No.
doesn't have problem, and third day have a problem. This is the peculiarity of China.
Okay. One day problem, one day no problem, and okay.
Yes. Every third day.
Every third day is China.
Yeah.
I thought it was magnesium, but I was wrong. Okay.
That's it.
Excuse me. Hello?
Yes.
Yeah. So the cuprum metallicum also has the same symptoms like the convulsions, epilepsy before periods, and it also has a periodicity.
Yes.
So in Allen keynotes, there is a peculiar line here that the spasms are periodical. Then, like, obviously, we can't take only calibrometum in this case, and we have to differentiate with all other symptoms with the cuprum because it has periodicity, it has periods before, epilepsy before periods. So
Yes.
both symptoms cuprum is covering.
If you read cuprum from Clark, Dictionary of Clark, you will find out there cuprum produce these peculiar character of spasm every time, because this is specific. Cuprum is specific. I will discuss with you. If you read cuprum, first line, spasm and cramp. This is the nature of cuprum. It produces spasm and cramps, and if this person is always give you one particular symptom that, doctor, when I sleep at night, I always have a cramp in the legs and I wake up from it. This is a key point where we can enter in this case. In this case, but cuprum is a psoric remedy. Cuprum is a psoric remedy. Kali bromaton is a syphilitic remedy. So we have to differentiate the psoric symptoms, syphilitic symptom, tubercular symptoms, psychotic symptoms. This is the main issue with us today, because understanding the depth, understanding the weight of the symptom is more important here. So
Sorry. But in this girl, are we very sure that this is syphilitic?
Yes, absolutely, because her family having so many type of issues there.
Okay, so we have to consider the whole case actually.
But more important in cuprum is the site, location. If you read epilepsy from keynotes, aura begin in knees and ascend.
Goes up.
Mostly during sleep. And about new moon, at regular interval, it means menses. Once the menses start, this problem start. This problem started with the menses. Menses start, but at regular interval from a fall or blow on the head, we have a causation here. We have a causation here. We have to find out if the person having injury to the head or not. If we don't have a causation, we will not select this remedy.
Yeah, more or less we have to go very deep in everything before prescribing, even on the peculiar.
So differentiation, we have to differentiate, because epilepsy is not an easy thing to cure. Every symptom, every causation, every time, how this patient start these symptoms, when this start. I have one person having because his father is very dominating, very dominating. They are three brothers, and he was the middle of them. One person, he's a MDS doctors now, and the small brother she is very sharp, and he run a business, but he is nothing doing. He is not able to take his decision. Because a father says, oh, you are not going this side, you have to sit here, and he was sit there. And the patient was cured with Staphylococcus. And if you see Staphylococcus, you will not find any symptoms of epilepsy.
Okay.
State is matter here. State of the patient matter here. Why he is comes to you? Why he did not get any relief from others? This is us to find out the reason why this person does not able to cure. Is it frustrated? If he is chin, I give you one more example. I have one lady, and she has a rheumatic pain, and she said, doctor, I will not take a medicine more than eight days. I leave it everything. That's why now, once my pains reduce, I will leave the remedies. What do you say? This is the state of frivolous. She is frivolous. She don't care. Once the pain stop, she stop the medicine. And I ask him, if I give the remedy, you will stop the remedy. Why I give you medicine then? Ask them. They will give you a very peculiar state. she is frivolous, and I gave her belladonna. And if you see belladonna, you will not find this type of pains. And Dr. Hahnemann says in 153, these are a common general symptom. Leave it. Don't take more attention to it. Find out the state of the patient. Don't care about the disease, how dangerous it is, how chronic it is. If you have a state, focus on it. And she says, doctor, I will not take the medicine. Once I pain stop, I leave it. I'm doing from last 12, 15 years. Once the pain stop medicine. That's why, because of this frivolous state, she is not able to cure. This is belladonna state. Light, very light. Indifference, frivolous. She knows that she has a problem, but she is frivolous on the other side. State. So we are focusing on state. That's why Alan's keynote. That's why I start Alan's keynote. So we discuss the states of the patient. So this is all about today's. So we will see you next week. So any medicine for soap allergy like sneezing, coryza. Call me Chandra. Yes, Chandra, call me after discussion stop. I will discuss with you. Thank you. So we will discuss the remaining part of this external application in next session. Thank you so much. And if you guys have any questions, let me know. We will discuss it first, and after that, we will start the session. Okay. Thank you. Bye-bye.
Thank you.